I understand that my contribution will be viewed by an assessor at the college for the purpose of assessment and marketing. I'm over the age of 18 and have agreed to be part of this DVD video assessment on a voluntary basis. I understand that this DVD video assessment or part of it may be used for the purpose of future review at the college or used in moderation for validation processes. I understand and agree that my personal details in this DVD video assessment will be stored and archived in accordance with the college policy and procedure. I have read and understood the college privacy policy and procedure found at www.vic.edu.au/policies and forms. My contribution has, to the best of my knowledge, been truthful and honest. I will not deliberately sought to conceal any relevant facts from the makers of this DVD video or the assessment reviewers.
My name is Amanda Chilcott. My student number is 00106989T. This is the Advanced Diploma of Naturopathy, ADVN F13 Naturopathic Framework. The central philosophies of naturopathy are vitalism and holism. Vitalism is our inner energy, our chi, our prana. It is a naturopathic belief that if we have balanced and strong vitality, we are less likely to become ill. If our vitality becomes weakened, we will in turn become more susceptible to illness. In order to keep our vitality strong, we must live a balanced lifestyle, mentally, physically, and spiritually. Holism, derived from the Greek word holos, meaning whole, is the principle of seeing things as a whole. To have a holistic view, you must look at a client as a whole, not a collection of parts as a general practitioner doctor might. Naturopaths identify each person as an individual and treat them as such. Every treatment is created for each individual, no two are alike. Whereas on the other hand, Western medicine treats the symptoms of an illness rather than the underlying cause, thus not seeing a patient as a whole. A naturopath would look at the whole person, including his or her environment, mental well-being, physical well-being, and social aspects. As an example, for the common cold, a Western medicine doctor would prescribe antibiotic to relieve sinus, fever, and muscular pain, whereas a naturopath would look at why the patient has gotten a cold. The naturopath would look into all aspects as mentioned before: environment, mental, physical, and social. The Western doctor would simply sit you down, ask why you're there, prescribe antibiotics, and send you on your way. A naturopath will spend the time to ask all the questions in order for them to gain a full understanding of the patient. The naturopath may then create a treatment plan which could involve better nutrition, rest, and fluid intake. They may also prescribe some herbal remedies, in return teaching them how to better take care of themselves in general and for the next time they become ill. We can apply these philosophies to our health in many ways. Firstly, by not always reaching for medications to suppress any symptoms. We can then look at balancing all aspects of our lives through correct diet, reducing our stress, exercise, and getting sufficient rest. Getting out into the fresh air more, meditating, and having a positive outlook can be beneficial to our lives in many ways. One being to boost our vitality. Nutrition is a big part of naturopathic medicine. Having a healthy digestive system is essential to maintain overall health. Herbal medicine and homeopathy are two more major treatments in naturopathy. Herbal medicine, as the name suggests, uses whole herbs as it shares the belief of holism. The whole is greater than the sum of the parts. Homeopathy, on the other hand, uses minimal amounts of highly concentrated mixtures of animal, vegetable, and mineral, as they believe that using such small doses stimulates the body's own defense mechanism in order to aid in fighting the virus. Massage is another well-used treatment. There are many variations including Swedish massage, deep tissue massage, sports massage, shiatsu, reflexology, and kinesiology. Any form of massage are generally run by the same concept of manipulating body parts to achieve therapeutic outcomes. Each technique of massage has their own variation of how they achieve this. Counselling is also a commonly used technique amongst naturopaths. By having basic training in such a field, the naturopath is able to make the patient feel safer, more secure, and make the room a trustworthy place to express one's issues. Although all these treatments boast immense healing prospects, there is contradictions to treatment in some cases, simply meaning that one or more of these therapies used in particular cases can cause more harm than good, so is not advised to be done. For example, massage therapy contraindicated when a patient is undergoing conventional cancer treatments. Some herbal medicines or vitamins is contraindicated during pregnancy, as they can cause more harm than good to both the mum and the unborn baby. A naturopath is expected to know when and when not to treat. as the first principle of healing is first do no harm. There can also be legal ramifications for using contraindicated remedies on clients. It is important to keep clear documentation as to why you could not use any of these treatments on a patient. Identifying any related issues to cautions and contraindications. Okay, now we are going to go through what is involved in a consultation appointment with a patient. I've decided to talk to you about a holistic patient-centered consultation. A holistic patient-centered consultation has 5 phases. 1. Explore the range of problems. 2. Understand each problem. 3. Determine the goals. 4. Provide treatments. And 5. Consolidate the patient's independence. Explore. During this first principle, the naturopath needs to establish a rapport with the patient, ensuring he or she feels as safe as possible. Ensuring the patient understands that whatever they say will be heard and nothing will be judged. The naturopath's empathy will be shown through the tone of their voice and the depth of their inquiry to the client's health issues. The inquiry should always be patient-centered, where the patient sets the boundaries of what they wish to disclose with the naturopath. Meanwhile, the naturopath needs to be aware of what is and is not being said and document accordingly. This gives the patient an opportunity to share and express their concerns and issues while not being forced to share. Understand. By understanding the problems, the naturopath needs to focus to gather more specific details of such things said by the patient that may relate to the occurring health issues. With the naturopath's facilitation skills, it will help the patient to accurately focus on said symptoms. While the naturopath also uses their clinical skills to concentrate on physical examination, body sign observations, reviewing medical reports, and completing a history to gain a holistic view of the patient. The knowledge and information gained from this and shared with the patient helps them to understand areas of strength and weaknesses within themselves to aid in the healing of said issues. It is also important in this phase to seek referrals to any biomedical or allied health professionals to help in the diagnosis. Set goals. This step involves working with the patient to negotiate goals and strategies to achieve positive outcomes for their health. The naturopath then needs to discuss any particular methods or procedures needed in the positive outcome. It is important in this step to give a prognosis of what the naturopath believes can be reasonably achieved within a specific time frame. This is the time when the patient has the opportunity to ask questions, discuss cost of agreed treatments. This is also a good time for the patient to become an active person and make an informed choice to achieve the set goals to better his or her health. The naturopath should always encourage the active involvement of the patient in this plan. Treatment. Now the task is to assist the patient in gaining better vitality, building their health resources and skills, and to lessen any health issues. The patient's role in this phase is to gain the self-help skills required to obtain optimal health. The naturopath's active encouragement is crucial in maintaining the patient's drive to self-help. The issues of compliance or how well the patient can follow the treatment plan need to be discussed in the most caring and empathic way possible, to ensure not to discourage the patient in any way. There may need to be strategies put in place in case this does happen. Any potential barriers to the treatment also need to be discussed, with plans put in place within the treatment plan to account for these. For example, if the treatment goal is weight loss and exercise is the main treatment plan, then the attitude the patient has towards exercise needs to be discussed and plans put in place to encourage the patient to do the exercise. Lastly, in this phase, the need to follow up is discussed. The naturopath and the patient together need to discuss whether this is necessary. The patient may require refining to the process to the treatment the process the treatment is following. This is another opportunity to refer the patient to any biomedical avenues deemed necessary. Lastly, we have independence. The final step to the holistic patient-centered approach is ensuring the patient's independence. The task here is to ensure that the patient has the necessary knowledge, tools, and resources to gain complete self-help skills. The patient should be encouraged to share their thoughts, good or bad, on their own progress, as well as any issues they have with becoming independent in their self-management. The naturopath should ensure they are clear to the patient about any necessary documents they need to bring with them during this consultation. For example, x-rays, medical history reports, any current medications, etc. The naturopath can then follow what was previously explained. The naturopath needs to also ensure that the proper documentation has occurred during this consultation. If there are any contraindications to any of the treatment methods planned, there needs to be documentation and alternative treatments need to be discussed. Expected treatment outcomes along with the treatment plan and overview of the consultation also need to be documented. The documentation should be stored in a safe and locked room away from anyone who does not have or need access to see or read it. The room should only be able to be entered by authorised personnel and signed accordingly. All naturopath clinics must follow the OH&S guidelines as with any other health-related business. All possible risks must be assessed and where possible eliminated. The Privacy Act should also be followed correctly. Any breach to this act could result in major fines or even the practice being closed permanently. A naturopath should also never call themselves a doctor or anything of the sort. Naturopaths are complementary medicine practitioners, not biomedical doctors, and should be proud to say so. Thank you for listening to my presentation.